The second point I want to make is about the uninsured in America. Everyone, you can't discuss healthcare without hearing about these 46 million or 42 million, the estimates differ, these uninsured people in America. And I find it hard to believe that you can even talk about uninsured in America when the majority of states, if not the entirety of the 50 states, have laws that require hospitals to provide care within the facilities of the organization, within the abilities of the organization. They require hospitals to treat patients in the case of emergency, regardless of the patient's ability to pay. If you walk into almost any emergency room, you'll find a sign posted in a prominent area of that emergency room that says you have the right under the law to receive services in this hospital for emergency care, or if you are in labor expecting a child, regardless of your ability to pay. So how does that leave someone uninsured exactly? I'm wondering. And in fact, it adds to this number of the so-called uninsured, because it doesn't take a rocket scientist to figure out that if you can walk into any emergency room and receive care because they are required to by government to give you care regardless of your ability to pay, that it doesn't make a whole lot of sense if you are on the margin. You know, if you're in that area of maybe you will or maybe you won't buy health care coverage for you or your family, it doesn't take a rocket scientist to figure out that you could just skip the health insurance and walk into an emergency room and let the hospital take up the bill. You know, and that is basically insurance that is paid for by the rest of the consumers who do purchase health insurance and who do pay for their health care, because it's just like Walmart knows a certain amount of shoplifting is going to go on in their stores. They don't take a loss on that. They figure that loss into the cost of the products for the honest citizens that do go in and pay for everything that they buy out of Walmart. That loss from the shoplifting and the theft is figured into the cost of the other products. And it's the same way with the hospitals. They know they're going to treat a certain amount of patients that aren't able to pay for that care, or they don't pay for that care for whatever reason, and they don't take a loss on that care. That hospital, that doctor still gets paid to perform the procedures he performs on that uninsured person. The nurses still get paid. Everything still gets paid, but they figure that cost of giving away a certain amount of free care into the cost of the bills that they send out for those who do pay for their own health care. And by the way, that drives up insurance premiums. That drives up the cost of insurance plans. That drives up the overall cost of health care. Okay? Not necessarily the evil insurance companies, because insurance companies will undercut one another in a heartbeat to get your business and to get your company or you or your group of employees to buy their insurance instead of their competitors. But that will drive up the cost of insurance premiums in a heartbeat, and it does every day. So, loving the insurance companies. My medical bills paid for because insurance companies want to be greedy and want to get my money. Want to get Michelin's money. Want to get my employer's money. And Michelin, being greedy, want to sell a lot of tires. They hire me and make this insurance as part of my compensation plan. So, benefits of capitalism. Gotta love it. More on this later.